but I am the Barbados Director of the Shaw Center for Paediatric Excellence, and that's why we're here to make our first donation of physical equipment to the Queen Elizabeth Hospital.
Yes, it's $170,000 in equipment, and going to the pediatric department, it's a major enhancement for us. Talk a bit about why this is so important, this relationship with the Queen Elizabeth Hospital between the QEH and the Shaw Center.
The journey is one towards excellence, and the actual physical equipment is only one station along the way. We started off with nurses, who are the people who spend the most time with children in hospital. We developed, in collaboration with the University of the West Indies, a postgraduate diploma in pediatric nursing. And so far, well, as of September of this year, we will have trained 40 nurses across the healthcare system in Barbados, nearly 20 of which will be in the Queen Elizabeth Hospital. So we will now have a cadre of nurses who have specific training in pediatrics. Now, when you're trained, you have to have equipment to work with. So that's what this phase of it will be. There is a similar or larger donation of the same kind of equipment that will be going to all the child clinics and the polyclinics. So the nurses will be working with the same kind of equipment across the healthcare system, whether it's in primary or tertiary care. And then the final stage as we progress will be to have quality improvement projects. So we take the newly trained personnel, we take the advanced equipment, and we actually make that into a better patient experience, both in terms of quality of care, but also in the social, physical, spiritual well-being, everything else that comes in to making the hospital safe for a child a better one.
You've seen both sides of the coin, being uh, a director here at the hospital, and then now a director for the Shaw Center here, their representative, their Barbados director. What do you like about the relationship in terms of making those steps, those improvements going forward?
It takes two hands to clap.
Mm.
So the hospital has been doing a wonderful job, I think, honestly, despite all the criticism, for a long time. But there is a lot of room for improvement. That takes not only money, but I think fair to say other experiences than what we have here. So working with a world-class partner like the Hospital for Sick Children and their global project will allow us to not just keep doing the things we've always done, but to improve to a global standard. And that's investment in human resource, which we have done. It's investment in equipment, which means money, which is part of the Shaw Center for Excellence project. But then it means application. And I think that is going to be our big challenge, to use the people with the equipment in a different way so that we can have a better outcome.